What's up, friends? Today I want to make a video about imposter syndrome. So I know a lot of people struggle with this, but first let's define what imposter syndrome is. Imposter syndrome is when you are placed in a situation, and whether it be like a leadership position or a position where you have more, autonomy or authority, when you're placed in this position, you feel like I'm not supposed to be here. I didn't earn this. I am not on the same level as these other people. I don't know enough. I don't deserve to be here. Like, I don't know how I ended up here. Like, I feel like I'm an imposter among these other people because everyone else seems like they know what they're doing and they're doing a good job. And I somehow ended up here and this is a mistake. So a lot of people feel like this when they're about to take the boards or they've just recently graduated, or they're preparing for the exam. So my big thing, guys, is when you feel like this sometimes, it's okay. This is a very human behavior to have, especially as you place yourself into a new role as a practicing clinician, because you are going to be in charge of people's plans of care and, well, not in charge of the plan of care, but you're going to be helping carry out the plan of care, and you are going to be in charge of the treatment and the interventions provided to these patients that are, somebody's grandma, somebody's, girlfriend, somebody's, child. Like, this is a responsibility. And I think a lot of people start panicking once they realize they have this huge responsibility and that they're at this point where they now have a license and they can practice. It's very human to start panicking about that and to feel nervous. However, I do want to put a caveat in here and a disclaimer saying, if this is making you so nervous to like take the exam, that you have been pushing off your exam, or you're going into basically a mental breakdown spiral over how anxious you are, that you can't sleep, that you can't eat, that it's affecting your ability to, go to the gym or like go to work. And like, you are so debilitated by this anxiety about having to, take the boards and like being this person who's going to be in charge of caring for people. If you are so anxious at that point, you need to be seeking professional help, because that's beyond just the normal anxiety. That is becoming more of a generalized anxiety disorder. I'm not trying to diagnose anybody, but you're kind of heading down that path of like clinically diagnosed like anxiety disorders kind of thing going on. So please see a therapist, get the help for that. This is a very treatable condition with, cognitive behavioral therapy and other therapies or medication combinations. So I just want to let y'all know, if you're feeling that anxious, please go get professional help about it. And it's okay to seek out professional help. I see a therapist, I take medication. That's helped me be who I am. And it's totally fine. So I just want to put that disclaimer out there. But this video is mostly for people, if that doesn't apply to you and you're just like, I'm just anxious, let's talk about this. Okay. So imposter syndrome, I heard somebody talk about this not too long ago. They said imposter syndrome only happens to people who are successful or who have experienced success. People who are not in positions where they've been successful will not feel this way, because they have nothing to be worried about, because they haven't accomplished anything. So I want you to realize that the reason why you're feeling this right now is because you've accomplished a great feat and you have been successful in your chosen career. You have gotten through PTA school. You got through the prereqs. You got through Anatomy 1. Anatomy was hell. Like, y'all made it through that. You got through your clinicals of being a student slave for weeks on end. You got through, all of your exit exams and stuff like that. You're preparing to take the exam. Maybe you've already taken the exam and you passed and you're still feeling this way. Here's the thing, friends. I want y'all to understand that the reason why you're feeling this is because now you've been placed in a role where you have more responsibility. And it's scary because I think a lot of you have never been placed in this sort of role before. I know some people feel this way once they have kids. They're like, oh my gosh, I have to take care of this kid and I'm responsible for not making it mess up like mentally. Like, oh my gosh, this is crazy. And I think people start feeling this panic because they think, I'm not ready for this. I don't deserve this. I shouldn't be here. This is a mistake. And here's the thing, guys. All of you deserve to be here. All of you deserve to be taking this exam. You have earned this opportunity. This was not a right. This was a privilege that you were granted. You have now learned the things that you need to learn and are now in a position where you can take an exam that will certify or license you to be able to do what you want to do, which is helping people with physical therapy. It is scary and it feels weird when you're like, oh my gosh, like I'm signing a note and just sending it to a PT. This is weird. There's nobody like truly like combing through my notes, like the PT might just like add something here and there and then sign it off, or just sign it off depending on what they do. Like you're not having that CI looking over your shoulder every 5 seconds anymore. You're just doing the thing. And so that's scary because it's something new. And that's the thing too. A lot of people get scared when they encounter new situations. The thing I want to talk about, friends, is that the feelings that you're feeling are happening because you have put in a lot of hard work. You put in a lot of hard work, dedication, energy, and it is scary. It is freaky. You're like, wow, I am already here. Like, this is the last bit. Like, what else is there to work for? Like, we're at the end. Now what? Kind of thing. That uncertainty of the unknown also scares people. But here's the thing, guys. There are people you can talk to. There are resources you can, talk to, and there are, mentorships you can seek out. This is not the end of the line. You can always, ask for help, learn different things. I'll eventually have something where I have a PTA mentorship program set up once I finish PT school. But y'all, there are resources out there that are going to help you learn things. And here's the thing, when you come out as a new grad, nobody's expecting you to know everything about everything all the time. Please look stuff up. There's nothing wrong with looking stuff up. Today we were talking about something in class. I was like, I have no idea what that is. I'm gonna go look it up. Or like, I forgot everything about it. I'm gonna go look it up. Totally fine. Nobody's expecting you to be an encyclopedia of physical therapy knowledge. It's fine. You can look stuff up. There's still stuff every day that I don't know. I even struggle with this sometimes when I'm trying to help you guys. I'm like, who do I think I am for saying that I can help all of these PTA students across the country learn how to do the boards? Like, am I really in this position where I can actually do this? And like, sometimes I get freaked out about it, but then I remind myself how far I've come. I have earned the ability to teach people this stuff. I've helped a lot of people. I have, passed my exam with flying colors. I've taken PETs recently and I've scored an 800 on every PET I've taken since I passed the exam. Like, I do know what I'm doing and I'm helping people. So I think also a thing that you guys need to do is reflect back on your accomplishments. Think about the patients you've helped during your clinicals that you're like, wow, that person got better. And it's because, I had a big role in their treatment. Like that was my like project patient basically to help them and they got better. Think about how your CI say you're great with the people that you've been working with, that you clearly show that you are, determined to learn more and that you want to reflect on things like this, like symptoms that you're having of like being like nervous and scared about it, not worried that you're not worthy enough, just shows that you care a lot and that you really want to be the best and you don't have to be perfect. I don't know a perfect clinician out there. It's okay. If you were perfect, I think that now we're in a simulation and you're like some AI bot and now I'm concerned and then we're going down a conspiracy like theory kind of rabbit hole. But here's the thing, guys. You are successful. You deserve to be here. You are smart enough. You are worthy. You will be a great clinician and you're going to help a lot of patients. So it's okay to be nervous sometimes, guys, but reflect on all the things you've accomplished and use that as proof to yourself that no, I do deserve to be here. I got this. I am successful. I know what I'm doing. And that's the big thing I just wanted to talk about, that you guys are worthy of being here and that you have earned this opportunity and you're going to help a lot of people. So again, if you're at the point where you're like, it's so anxious, like that you can't sleep and stuff like that, that's where you need to see somebody. But for those of you who have these fleeting feelings every once in a while, it's normal. Here's how to go back and like reflect on it. I use my journal. I write down a bunch of things of like my accomplishments and stuff like that and the reasons why I deserve to be here. And anytime I start feeling down on myself, I reflect back on those. I'll look back on testimonials of people who have been like, Breeze helped me so much. I wouldn't get here without her, even though I know y'all do the hard work. I'm just here to guide you, but that's what I look back on. So I struggle with this sometimes as well. So just want to let y'all know you're not alone in what you're feeling and you're going to be just fine. It's going to be okay. Reflect on all the positive you've done and you're going to do great.